birth control. What's the best option for you? How do you even begin to decide? Stick around because I'm about to break down all the options so you can make an informed choice. Let's dive in. Okay, first things first, why are we talking about birth control? Whether you're trying to prevent pregnancy, manage a health condition like PCOS or endometriosis, or just regulate your period, there's no one-size-fits-all solution. But knowing your options, that's empowering. Let's take a look at the different types. So there are 5 main categories of birth control methods: hormonal, barrier, long-acting, reversible contraception, LARC, permanent, and natural. Let's break them down. Number 1, hormonal methods, birth control pills. Combination pills have both estrogen and progestin, while mini pills only have progestin. Some popular brands are Yaz, Lostrin, and Micronor. They're about 91% effective with typical use. Pras, they can help regulate your period, clear up acne, and even protect against ovarian cysts. Cons, you'll need to take them daily, and side effects like nausea or mood changes can happen. The patch, like Soulane, goes on your skin and gets switched out weekly. Same hormones, but you don't have to remember a daily pill. Ring. Ever heard of NuvaRing? It's a flexible ring you pop into your vagina once a month, super easy and low maintenance. The Depo-Provera shot lasts for 3 months. Great if you tend to forget things, but it might cause some irregular bleeding. Number 2, barrier methods. Condoms. Condoms are 85% effective with typical use, and they're the only method that also helps protect against STIs, so always keep some on hand. Diaphragm and cervical cap. These are reusable devices that cover your cervix to block sperm. Less common, but still good to know about. Spermicide and sponge. These can give you extra protection, but they aren't as reliable on their own. Number 3, long-acting reversible contraception, IUDs, intrauterine devices. These little T-shaped devices, like Mirena or Paragard, sit in your uterus. Hormonal IUDs last 3 to 7 years, while copper IUDs are hormone-free and last up to 10 years. They're over 99% effective, and once it's in, you can forget about it. But keep in mind, insertion might be uncomfortable for some. Implant. The next splant-on implant goes under your skin and lasts for 3 years, another super effective and low-maintenance option. Number 4, permanent methods. Tubal ligation. This is a permanent surgical option. It's for those who are absolutely sure they don't want kids. Vasectomy. For the men out there, it's a quick and effective procedure with minimal recovery time. Number 5, natural methods, fertility awareness. Tracking your cycle with apps or methods like basal body temperature can be effective, but it takes commitment. Withdrawal. This method is less reliable with about 78% effectiveness. Not the best if you're really serious about preventing pregnancy. All right, now that we've covered the options, how do you pick the right one for you? Here are 5 questions to ask yourself. 1, what's your lifestyle like? 2, do you have any medical conditions? 3, how effective do you need it to be? 4, are you okay with potential side effects? 5, do you want kids in the future? Let's bust some common myths about birth control. Myth 1, birth control causes infertility. False. Once you stop using it, fertility usually returns to normal within months. Myth 2, you have to take breaks from birth control. Not true. Long-term use is generally safe for most people. Myth 3, IUDs are only for people who've had kids. Not at all. Modern IUDs are designed for anyone who's a good candidate. Got questions? Drop them in the comments and I'll answer as many as I can in a future video. So, that's a complete guide to birth control options. Choosing the right method is a personal decision and should definitely involve a conversation with your healthcare provider. If this video helped you, give it a thumbs up, share it with someone who might benefit, and don't forget to subscribe for more health tips. Thanks for watching, and I'll see you next time.